All right, talking about your health tonight, we are joined by Dr. William Krimsky, director of the Interventional Pulmonology Center at MedStar Franklin Square Hospital. We're talking about your lung health today, and it seems like, doctor, more and more people are being diagnosed with lung cancer. We just had Monica Barlow from the Baltimore Orioles. We lost her a couple of years ago.
That's right. That's right. Yeah, Kelly, thank you so much for having me. I think it is true in different ways, in the sense that I think lung cancer and our ability to actually screen for it has changed things as well. In other words, we're seeing it, we're able to detect it a little bit earlier, there's some other new techniques, and so I think at least in part that explains some of the increase in diagnosis.
So how is lung cancer diagnosed?
A couple different ways. It's sort of a complicated question, but the basic ways are through a biopsy, and that can either be done through the mouth or through the side of the chest or surgery. Otherwise, what you're really doing is just taking pictures and really getting a sense of what's in there, as opposed to actually getting tissue, which is important. And there are some new developments as far as whole blood tests and such like that, but bottom line is right now you need tissue to make a diagnosis.
Why is it important to get that biopsy?
It actually, much like anything, there is not one cabinet that just has cancer on it. In fact, quite the opposite is true. Lots of different types of cancers, which then correlate to lots of different types of therapies. So therefore, we have to know what type of cancer it is and what stage it's at in order to give you the right therapy.
And how do you obtain that biopsy, and is it painful?
It depends. I was always told that the only minor procedure done is the one that's not happening to you. So I think there's an element of discomfort in all of these. One procedure, as I said, is done down through the throat, called a bronchoscopy. And they're all very good procedures, by the way. Another one is to put a needle through the chest, and that's called a CT-guided biopsy. And then the other one is through a form of surgery, and there are many different types of surgery.
Are we seeing people living longer if it's caught earlier?
Yeah, I think so. I think that there has been a huge change recently, I think in the last 5 years, with respect to lung cancer and what you're able to do it and how you're able to treat it. Much more targeted therapies, and that has made, especially in certain patients' lives, a huge difference.
Okay, all right. Dr. Krimsky, thanks so much for coming in.
Thank you.
One of our many experts from MedStar Health Cancer Network. We're taking your calls up until 6:30. The number to call is 410-481-2222.